Hi, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to be talking about all kinds of dental work. We're going to be talking about dental work and how it relates to your orthodontic treatment, timing of things, when to get wisdom teeth out, when to get implants, when to get bridges, how that affects your orthodontic or aligner treatment or your braces treatment. So much to talk about. This is probably going to be a long video, and I have my handy dandy little typodont that I got today to help you guys out understand things a little bit more. So let's start with the first things first. Let's talk about wisdom teeth. It's a super popular subject. So let's talk about the different classifications of wisdom teeth and my personal opinion on what you should do if you have wisdom teeth before ortho. So first of all, it depends on your age, right? If you're 12, 13, 14, we're probably fine. But if you're 17, 18, 19, 20 through maybe 25, we might want to get them out. If you're older than 30, you've had them for a while, you're probably okay. We're probably fine. So age is a big deal. Now let's talk about the position of the wisdom teeth and how that might affect things, okay? So ideally, wisdom teeth, remember, are teeth number 1, 16, 17, and 32, okay? So tooth number 1, okay, is right here, all right? 16, 17, and 32, okay? So those are the last teeth you're gonna get in your mouth, and a lot of times they get stuck and they never ever come in. And sometimes they come in and you have to get them pulled out because they're so far back there and they don't come in perfectly, and you get gum infections and cavities, and they end up really causing a lot of pain. So most people end up getting them out just as a precautionary preventive situation so that they don't cause a lot of pain and swelling, and they can even kill you if they get infected. They can travel up to your brain, they can travel down to your lungs, down to your neck. A lot of dangerous things can happen with an infected wisdom tooth. That's why most military people, I think they have to have theirs pulled out before they go to boot camp or get deployed. So, just to be safe and healthy. So, but ultimately that's your choice, So let's talk about positioning. So if they're impacted, there's a couple different ways they can be impacted. So, and you need an x-ray in order to see this. So this is a vertically impacted one. This one doesn't scare me very much. I don't mind you leaving that. There's always a risk that it might damage the adjacent roots to the healthy number tooth next to it. But for the most part, it probably won't mess with your ortho. So it's okay, would be my answer to that. You want to get it out, get it out. You want to leave it. Just keep your eye on it. Make sure you're keeping everything clean and get your x-rays taken regularly. But also a good idea to get it out. Second one that you have very often would be an erupted one. It comes in, but it comes in kind of funky, like this one, okay? So this is going to kind of mess up your bite. So in this case, usually orthodontists don't straighten wisdom teeth. They don't rotate predictably. Maybe you could do it easily with Invisalign if you had a scanner. Most of the time, we're just going to shuck it out. So it's just really not that useful. It's a tiny tooth. But ultimately your choice, okay? So if a wisdom tooth comes in all the way straight, I'm fine. You can keep it, okay? What else? What about this one right here? This is an impacted one. Can you see it? It's impacted, it's under the bone, but it's partially impacted. That means part of the crown is erupted. Can you see it right there? Oopsie, sorry. So part of it is above the gum surface. This is the most dangerous one. This one is most likely to cause infections, pain, severe infections, like ones that might end you up in the hospital, like at a random time. No warning. It's basically a ticking time bomb if it stays like that. That needs to come out ASAP. Goodbye. Get it out. Definitely before ortho, 100%. High likelihood that it's going to transfer, decay to the other tooth and possibly kill this tooth as well. And you can see this tooth is actually already dead because it had an infection. So that's why we want to get that out. And lastly, we have the sleeping tooth. It's like a wisdom tooth that's sleeping. It's on its side, it's taking a nap, it's horizontal instead of vertical. We don't like that one either because the crown is touching the roots of a healthy tooth. It can cause trouble, it can cause movement, it can cause decay, it can cause pressure, it can cause pain. This serves no purpose to you, so get it out. There might be a point in time though that when you have one of those that you can't get it out if it's too close to a nerve. There is a nerve that runs around here, and if it's too close to the nerve, if it's already too developed, you're probably gonna have to keep it and just manage it. So better to grab these before you get too old and the roots become too developed and get too close to the nerve. So that's why it's important to get wisdom teeth out during proper timing. Most people get them out maybe 16, 17, 18, 19, 20, college times. Around college time. I think I got mine out when I was like 20. Some people have 4 wisdom teeth, some people have 2, some people have 3, some people have 1, some people are lucky and have none. I had 2. I think my daughter has 3. I think my son has none. So, lucky. But anyways, that's all about wisdom teeth. Let's move on. More things to talk about. Now we're going to talk about implants. So implants are screws, okay, that are drilled into the bone. Now here you've got two implants here. This is actually implant supported bridge. It's not just a single unit implant, but you get the idea. So basically the way it's going to work is that usually it's done in a two-step process where either a periodontist, an oral surgeon, a prosthodontist, or a general dentist will go ahead and put the screw in. It's really important that your teeth that are adjacent to it are parallel, which is why if you're thinking about getting orthodontics, I recommend getting orthodontics done first and then getting the implants placed. That way it'll just be way more accurate, way better outcome. So sometimes people do things the other direction. We'll manage it. If so, you just won't quite get as good of an outcome because you can't move those teeth, right? Because they're stuck to the bone. So it gives us less teeth to work with. Usually it's a two-step process where they're going to screw the screw in first, let it integrate with the bone and get healthy, and then they're going to load it with the restorative crown or whatever it is later. Sometimes it's screwed in, sometimes it's cemented. So a couple different ways to do that. But that's usually the way it works. So again, this is usually done after ortho. If you are thinking about getting an implant or a bridge, you should really consider an orthodontic system that takes x-rays and utilizes x-rays as a requirement. That would be my suggestion, because you will get a way better outcome if you do that. There are some systems out there that don't use x-rays. So I'm just letting you know on the front end, that's a question you'd want to ask. I would always do that. If you're doing a bridge and on implant, it's probably not quite as critical. That is with an implant. What else? That's pretty much it. I'll show you the difference between an implant and a bridge, just so you can see. So you saw the screw retained implants. Now this is just a typical bridge. Two healthy teeth. If I can get it off, pretty sure this is a bridge. Okay, oh, there we go. Two healthy teeth. They take two healthy teeth and they reduce them down to little nubs, which I think is kind of sad, because if you just had one space here, why would you want to potentially kill two other teeth? You might need root canals. They're not going to last that long just to fill in a space with a bridge, right? It doesn't make sense to me. But this is old school. New school would be an implant. Bridges maybe last 5 to 10 years. Implants can last a lifetime when they're done right. So, and you don't have to worry about flossing, and they're just like a regular tooth. They're really good teeth. So definitely I would always pick an implant over a bridge, assuming you have the bones in order to be able to support it. Of course, if you're a smoker or you have health problems, that may not be an option, because it really depends on how healthy your bone is. History of head and neck cancer, radiation, there's all kinds. You've taken bisphosphonates. There's all kind of medical contraindications for implants sometimes. So again, I'm not an implant surgeon. I'm not a specialist in implants. I just prepare teeth to get them ready for people to get implants, but I do know somewhat about them. So anyways, that's all about wisdom teeth, third molars, implants, bridges. You know, other things to talk about would be crowns. So you can see here, there's a crown. Well, actually, this is an implant retained crown. So this is a single unit implant crown. And it just goes on like this. It's another thing. Lots of different fancy restorative work. So lots of great doctors out there. And the good thing about the team at Proline is that we're an interdisciplinary team. And on our team, we have orthodontists, we have general dentists, we have all kinds of people who understand how to work with other doctors and patients, and we'll be glad to help you out. All right, thanks so much. Have a good day.